So, Professor Lichtenberg, you're a famous German angiologist specializing in deep vein thrombosis, and you're here with us today for a specific interview on DVT. Thank you for your time.
Thank you for the invitation.
And let's start then.
Okay, perfect.
How do you see the role of thrombectomy during venous thrombosis?
I think thrombectomy is the most effective strategy for removal of thrombus of the deep vein system. In the former times, we did not use thrombectomy. We used local lysis therapy. We saw patients with bleeding complications. Patients had to stay on ICU for this treatment for a long time, 24 hours, 36 hours. And using thrombectomy, we have different devices available. It's much more effective and even safer for the patients.
What is the complementary role of venous stenting?
Most of the patients who suffer deep vein thrombosis have an underlying reason. One of these reasons are compression syndromes of the venous systems, like May-Turner syndrome. There are also other compression syndromes due to cancer, whatever. And this needs a stent to treat these underlying reasons. So first is the thrombectomy, and the second step is a venous stent implantation.
What is the place of thrombectomy in acute limb ischemia to salvage an occluded bypass?
Also, for this indication, thrombectomy is, in my personal view, the most effective therapy strategy. We can avoid local lysis therapy. We do not have to send the patient to the intensive care unit. We can just use the thrombectomy system, take out the fresh thrombus, and we finalize the emergency in the cath lab on the same day in the same session. So this is safe, effective, and quite quick for the patients.
What kind of devices do you recommend for thrombectomy?
Our preferred choice is the mechanical thrombectomy system from Straub Medical Systems. It's for the venous system, the ASPIREX system, and for the arterial side, it's the Rotarex system. It's coming in different sizes, and depends on the size of the vein or the artery, which kind of catheter you use. But this is our preferred choice for thrombectomy.
What kind of antiplatelet therapy or anticoagulant do you recommend after venous stenting, and for how long?
Usually we recommend anticoagulation with fenprochromone, for instance, and we usually recommend 3 months minimum. It's better to use 6 months. This is due to the current study situations we have. So in my center, we use 6-month anticoagulation with fenprochromone.
In regard of in cath lab, you have already been a contributor, so you know what we propose and the website. Why would you recommend to register on in cath lab?
The real advantage of in-cath lab is that you can see all the procedures which were filmed during sessions, conventions or symposiums, and you can always go back to these films. So from a training point of view, it is really helpful, especially for young interventionalists. It is good to see different techniques. And you can always go back to this incathLab.com platform so that you can, whenever you have time, see these videos and you can learn from these videos.
Okay. Thank you, Professor, for your time that you dedicate to InCath Lab and today.
You're welcome. Thank you.